di crop terus di screenshot terus dikasih judulnya bisa. Terus ini juga harus dijelaskan nih mana orang orang apa gitu. Terus ini dari tahun ke tahun dan ini bukan
Okay, I guess you can start whenever you're ready. So everyone, this is doctor. Should I say doctor? Wait, let me screen record this. Okay, this is Dr. Sophia Hage, and she's gonna talk to us about sports and exercise. There are many different types of sciences, so we're gonna be talking, or she's going to be presenting to us about sports medicine and what does science have to do with sports and exercise. So
Thank you.
I hand the floor to you.
Candy. Thank you so much. Hi, everyone. Thank you for joining the session. I am Sophia. You can call me Sophie or Soph. I am a medical doctor and I specialize in sports medicine. Like the intro previously said, I'm a medical doctor. I'm a physician. So I took 6 years of medical degree and graduated as a GP. And then I took another school, another 4 years, 5 years actually. 5 years of medical residency in sports medicine in University of Indonesia. Now, we're going to talk a little bit about, currently, my role is as a sports medicine specialist in a sports clinic in Jakarta, in Senayan City. And I'm also the attending doctor for the National Sports Climbing team, who currently is having a World Cup competition in the US, in Salt Lake City in USA. So I'm currently rooting for them. They're going to start 28th of May on Speed and Boulder. So I'm going to talk a little bit about, a little bit more specific on what is sports science and sports medicine specifically. And welcome to the session. So usually when people ask what my profession is, and I say a sports medicine doctor, they would say, oh, so you handle athletes. I guess the most common knowledge of sports medicine or sports science is usually related to performance. But that's not all what sports science or sports medicine is actually ranging on. Now, my personal experience that made me decided to go into sports medicine is actually from my years of medical degree. So I'm the classical nerd when I was in high school. I loved science so much, and especially biology, that I went into medical school. And after I graduated as a medical doctor, I realized that when I wanted to help people, I was actually quite limited because of my health capacity. Why? Because I was having regular monthly migraines. And during those regular monthly migraines, I, of course, medicate myself with pain medication and regulation medication, as much as I was taking a pill almost every day. Now, that kind of lifestyle was something as a scientist and as a medical doctor was perplexing for me, because I wanted to help people, and yet one, I cannot help myself because I cannot function sometimes when I was in really severe migraine. Two, I really feel like the conventional science was failing me, because theoretically, with consuming regular pain medication, I should be able to control my pain. I should be able to manage my pain. But the answers from the traditional and conventional medicine was not what I was expecting. And so that was my start of the journey with sports medicine science or sports science. And some people know it as sports science, but it's actually sports and exercise. So it's not only in Indonesian, we call it olahraga. But in English, there's a distinction between sports and exercise. Sports being there's a specific type of sports, for instance, cycling, swimming, tennis, even boxing and martial arts. And exercise is just the leisurely activity that you do outside of the daily activity. So for instance, also running and stuff, but more general usually, and not a specific type of sport. Now, when I talk about sports medicine, I usually talk about sports and exercise. So it's a form of physical activity that requires an exertion of energy and is being done outside of the daily activity. So if I say sports medicine, that's what it concludes. When I realized that the conventional science was failing me as a person, as a patient, I started to look into what I should be able to do as a person. So I took off my scientific hat and actually look into my life. And that was, ironically, that was also the start of my new found interest in exercise. Now, I realized that as a medical doctor, we learn a lot about the chemical of or the substance of drugs and medication. But we do not learn as much about the science of exercise or the science of how our body is moving, what benefits or what hormones, what chemicals are actually produced during the physical activity and the exercise session. And so when I actually started exercising regularly and started actively participating in sports, I put my science back on and the science hat back on and started to look what it is that actually made me feel better. Because after doing regular exercise almost every day, only about 30 minutes in a day, I felt significant improvement in my migraine. Now, we know that there are health benefits of physical activity. We now can quantify the effect, the benefit of physical activity into specific numbers. The recent one is dementia, that the risk of dementia can be decreased up to 30% with regular exercise. But we do know that generally it will reduce the general cause of mortality by around 30%. If we go to the specifics, we can also even reduce depression by up to 30%, colon cancer by 30%, breast cancer by 20%, etc., etc. So the beauty of exercise is that we can actually now really look into the specific numbers and the specific mechanism that actually would quantify the health benefit. So it's not only about reducing, but also reducing by how much. And there is something that we call the dose-effect relationship. So if we do exercise regularly three times a week, minimum accumulates to 150 minutes a week, and being done for a minimum, at least the long-term benefits we know that is minimum being done by 2 to 3 months, we can actually quantify it. And this is what we call as a dose-effect relationship. That doesn't happen with just daily activity. Like for instance, up until now, I haven't read any scientific report that actually say clean your room or do housework or household chores up until 30 minutes a day and you will reduce your dementia risk by 30%. Up until now, we cannot do that because what's specific or what's unique to exercise or sports is that we can quantify the frequency, the intensity, the type, and the duration. And because we can put a number on that specific, we call it FITT. Very simple, right? If you think about exercise, think about getting fit. FIT is also the acronym of frequency, intensity, time, and type. Now, if we can quantify the FITT of the exercise, then we can also quantify the effect, long-term and short-term of the exercise. So that is the science of exercise. So when now recently in the last 3 to 5 years, we know if we look into the general knowledge, usually they would categorize it with physical disorders. For instance, cardiovascular disease, stroke, hip fractures, depression, colon cancer. Only in the last 10 years, we have seen a lot of imaging studies on the effect of physical activity or exercise specifically on the brain. And we see this through, now we can quantify the reduced risk for dementia and also major depressive disorder. Now, this is another science behind the body movement. Usually, if we look back at about 3 to 4 decades ago, the knowledge on exercise is mostly focusing on metabolism, on physical effects such as the organ system, as in the heart and the lungs and the muscle and the bone, but not specifically on how they change the brain function or the brain neurons or even signaling pathways. Now, what's almost I think is also emerging, and unfortunately we haven't seen in Indonesia, is the interest in genetic medicine. And how physical activity actually can correlate to the epigenetic signaling of genetic medicine. Now, I'm taking the case of a major depressive disorder because it's a very typical case where it activates so many signaling pathways that goes beyond just the bodily function. So if we look into the chemicals, the neurogenesis synaptic number increases, and the level of chemicals that actually increases the happy feeling. Serotonins and endorphins are actually increased even acutely, so directly after an exercise session, or in long term, chronically by an exercise session that is being done regularly, minimum how many times a week in a certain period amount of time. Now, do that for more than a year or two, then you start to see that it goes deeper into the cellular level. It's so deep that it actually changes your gene expression or gene activity. And now we are starting to see that mothers who are active in exercise or physical activity while they're expecting is actually then passing on some metabolic effect from the exercise to the fetus in the mother's belly or tummy. So if we go into the cellular level, in, again, specific major depressive disorder, this case, the power of the chemicals that is being produced by physical movement is actually a lot is being regulated by serotonin, which regulates mood and cognition. So if somebody who is depressed say that they cannot focus, it's not only a sense of feeling, but it is actually chemically in the brain affected by the depression in a way that the brain functions differently, and the chemical in the brain levels are different when somebody is experiencing a phase of depression or a phase of anxiety or panic attack versus somebody who's in a normal state where they're not experiencing any depression, anxiety, or panic. Now, this is the magic of exercise, or the science of exercise. Well, I like to say the magic because some people who doesn't understand the science of it will see it and see like, oh, that's magic. Exactly, that's science. So with exercise, there are certain metabolic cycles that are being activated that would result in serotonin production. And the increase in serotonin would actually reduce the inflammation and stress directly. But on top of that, it will also then be associated with this feeling of lightness, this feeling of happy feeling, the happy hormone, right? And if you look into it deeper, the cycle when the serotonin is actually high, then it would limit the stress-related hormone, the cortisol hormone, the tryptophan hormone, the kynurenine is one of the most recent found chemical that is associated with depression when accumulated in the brain. Now, I won't go into detail into this because I would like to take several samples of case studies that you see that in sports medicine we handle or we see or we look into it. Now, if previously we look into major depressive disorder, in the last 5 years, a lot of the science and scientific reports and cases and a lot of the research has gone into dementia prevention. As we know, a lot of the population has now gone into an aging population. Indonesia is not one of them because we're still quite balanced between young and old. But if you look, for instance, in Singapore and in Japan, the population is starting to skew into an aging population. And that is why there is a heightened interest and funding as well in research associated with aging and healthy aging, and specifically dementia prevention. Now, for instance, I think it was 2 years ago, before the pandemic, Bill Gates Foundation actually just donated a large sum amount of money into supporting funding for research in dementia, not only in prevention, but also in prevention and treatment. Now, because of these kind of funding, now we can actually find that around 1/3 of dementia cases are attributable to modifiable risk factors, such as nutrition and exercise. And so when we say exercise is good for your heart, well, what's good for your heart is also good for your brain. And again, similarly to the chemicals that are being activated through the physical movement for major depressive disorder, we also see a lot of chemicals and metabolic pathways that are being activated through physical movement and affects the way the brain functions and can prevent dementia. Now, what we don't know as of yet, as of now, is what is the optimal dose. If you remember, a few minutes ago, I mentioned dose effect. Now, that's the important key point in quantifying the effect of exercise towards health and other medical disorder. Because the new tagline right now, the paradigm right now is exercise is medicine. So it doesn't mean that we are leaving conventional medication towards exercise. No, it's actually complementing one or the other. So we do not only put emphasis on the effect, the therapeutic effect of medication, but we are also looking into how there are therapeutic effects through modifiable risk factors, which is through lifestyle, through exercise, through nutrition. And in certain cases, such as depressive disorder, we actually see that it is almost the same. The effectiveness is almost the same. The intervention of physical activity or exercise is as effective as cognitive behavior therapy in major depressive disorder. Now, this we don't know yet in dementia prevention. We don't know the dose. We don't know the frequency and intensity and type and time yet. But in the next 5 to 10 years, this is going to be a very interesting and promising research study. How much do you exercise that you can actually increase the performance of your brain? How much do you need to sit less? Because too much sitting is also the new killing machine. The WHO even said that too much sitting will kill you. And it's the fourth most leading mortality cause in the world right now, especially since work from home and school from home is the new norm because of the pandemic. So it's going to be interesting in the next 5 to 10 years. How do we see how do we need to reduce our sitting time? How do we need to increase our exercise time? And what kind of exercise? Aerobic exercise, strength exercise, is flexibility exercises doing anything to dementia prevention? And does exercise have different effects for men and women? Does it really matter when do you start exercising? Is there any different when you start exercising in teenage years versus adult years? Specifically for dementia prevention, these are the research questions that we are looking right now and trending right now. We have yet to see a consensus on it. But again, this is going to be a very interesting subject of research and findings for the next 5 to 10 years. So if the first 5 to 10 minutes I have been explaining about the medical disorder or specifically on how exercise and physical activity intervention can actually serve as a therapy, that's actually only a small percentage or some percentage of what sports medicine is handling. So outside of that, in my daily practice, I think around 80%, 70 to 80% of my patients are actually sports and exercise related injury. So they would come after, for instance, a bad technique when they were doing tennis and they have elbow pain. Or they were doing a basketball and then they sprained their ankle. Or these are people who are actively running and jogging and then would hurt their knee or any part of their legs. And it's also medical conditions that can be managed with sports and exercise, like the first two slides of my presentation. But there's also the third aspect, which is the performance-related goal or the performance-related cases. Here we see cases with athletes who are, for lack of better words, are training to be superhumans, are training to run faster, to lift stronger, to jump higher, and to go beyond the normal capacity or what is considered normal by the normal people or the normal population. So these are the different aspects of sports medicine. Yes, it's partly injury. Yes, it's partly medicine, but it's also about performance. So not only handling disorders or diseases, and it's also managing medical conditions that is related to sports and exercise. So these are the common questions that I would get if I go into a typical party or if I go into a typical hangout or a meetup. People who are parents would then ask me, can my 11-year-old son or can my 12-year-old daughter be a professional soccer player or tennis player or swimmer or basketball player, whatever, right? So they would ask whether or not my children are cut for elite sports. The next question would be, well, I'm just starting to go into running. Can I finish the marathon less than 4 hours by the amount of training that I'm actually doing right now? And that is usually related to the sports performance and the programs that is related to sports and exercise participation. But there's also, hey, my mom has diabetes, or my dad has diabetes. Can I reduce my risk of getting it? Or how can I help my mom or my dad control the medication better? Control the blood sugar level better while taking the medication regularly. And sometimes it's my father just died of a heart attack and I'm worried, can I prevent myself from getting one? Or how can I prevent my kids even from getting one? And hey, can I play basketball in 2 months or soccer or run in a month? I just sprained my ankle. Or can I run again after I broke my knee? These are simple applicative cases that you would see if you go into sports medicine or sports science. Now, to answer the first question, if we look into what constitutes the elite athlete, what constitutes somebody who is successful in sports as performance, as a level of achievement, for lack of better words, that superhuman level, right? Being the superhuman level. Now, I am taking the example of Michael Phelps. Michael Phelps is the most successful Olympian to date. And he has collected, I think if I'm not mistaken, 28 medals in his lifetime. And he's not done yet, as we know. He's still active and he's still going strong. Now, when we look into what makes Michael Phelps a very good or excellent swimmer, excellent Olympian, is apparently that he's not only tall, but there is a specific measurement in the body that we call the wingspan, which is basically the arm span on both ends. So from one fingertip to the other. Now, his wingspan measures almost at 2 meters, which in one stroke is already covering a good distance of the pool. So it only requires, for him, it only requires fewer strokes to cover a 50-meter pool. And if we compare between his height, which is 1.93 meter tall, and 2 meter in wingspan or arm span, his arms are actually longer than his height. Now, previously, the research question was, is a certain body type then should be screened to go into certain specific sports? Or is the sport then molding the athlete? It's now we're actually learning that it's a little bit of both. Previously, the paradigm was that a perfect athlete has the perfect measurement of symmetry in general. So there is no long arm span, there is no long leg span, there is no long torso, everything is just average. But now we see that that's wrong. There is certain specifics, certain anthropometric numbers. What we call anthropometric measures is actually the measurement of the body components. Now there are certain anthropometric measures that is helping a person to excel in certain sports, and now we're seeing that a lot of the elite athletes are now not general built, not average built. They're usually in one extreme to the other. If we see Michael Phelps as tall, but then we see the gymnasts, Olympians, are short in stature, because it makes better power coordination when they do a full cycle on the floor or on the mat, or on the gymnast hurdles. So it's all the anthropometric measurements is now actually going specific into the sport-specific cabang olahraga, the sport-specific types. Now, the question whether or not one is screened towards that versus the sport is molding that athlete, and now we start seeing, because when a person is engaged in a way that is very specific or specialized to a certain sport, that person most likely has started their journey in sports from a young age, from an early age, usually before they hit growth spurts. Growth spurt is the exponential increase of growth in height, usually in children. So for girls, that would be 9 to 10 years of age. In boys, that would be around 12 to 13. So usually we see these very good elite athletes are already doing a lot of sports, not specializing, but doing a lot of multiple sports in a serious doses, in a serious dosage and frequency, starting when they're pre-teen, like 9, 10. They're already involved in multiple sports. So then when they started specializing when they're 12, 13, or 14 or 15, there's also a higher possibility that when they specialize and they only do one sport, the body then adjusts itself, adapts itself, so that the measurement of the body is then adjusting to their specific sports. So we don't really know for sure whether or not Michael Phelps is born this way. It might be the case that yes, he is predisposed, or he is born in a way that he's tall and he's not average built. But the wingspan, the flexibility, the lung capacity, and the short legs might actually be an adaptation of so many years and decades of doing one exercise or one sport, not exercise, one sport, swimming. Now, this is then also what we see personally, because I'm involved in the sports climbing national athlete. I am involved in their athlete selection and how we pick and choose a certain athlete to be the national athlete in sports climbing that is potential, and that has potential, and that has the capacity to actually excel and achieve certain achievements. Now, this is actually the components that we look into when we did the national athlete selection for sports climbing, and was just last year. So, in an aspect to anthropometry, we actually look into their posture. We don't want anybody who's scoliosis. We don't want anybody who's kyphosis. So the spine form has to be, for lack of better words, normal. And the height and the weight should be lean. So they're not stocky, they're not muscular. And the arm span is long, like swimming, like Michael Phelps. So those who have a very tall build, lean build with an arm span that is long is already one step ahead in getting into the national athlete selection. And then the second part, but it doesn't stop there, right? Because one, of course, there's nature, there's genetics, but there's also the capacity or the performance level, the fitness level, which actually can be trained, which actually can be modeled, can be pushed, can be geared into specific achievements. So that is when we look into their functional movement. How is their joints? Is there any pain? Is there any history of ligament rupture? Is there any history of tendonitis or inflammation of the tendon and soft tissue surrounding it? And then what is specific to sports climbing, I think, is also colorblind test. For instance, if you're a soccer player, it doesn't really matter if you're colorblind or not. But in sports climbing, it becomes specific and it becomes important because in certain aspects of sports climbing, for instance, in sports climbing, we know there's speed, there is boulder, and there is lead. So it has three specific track. For the speed sports climbing, it's not as much colorblind because there's only one specific track and you go at it as fast as you can. But with lead and boulder, it's actually very color specific because then you would see a certain track is colored black or a certain grip is colored blue, a certain grip is colored green. And during the orientation of the athlete, when they are just about to go into the track, the coach will then talk to the athlete and sort of calculate which track is actually the most efficient to finish it in a certain amount of time. So then can you imagine if an athlete is being told by the coach, say, can you grip the green grip and then jump into the red one? And then for somebody who's colorblind, green and red is going to be in different color. And then if the coach is saying that, okay, skip that black one and just go into that white one, that can cause a totally different track in the mind of the athlete if they're colorblind. So that's why it becomes very important to also test for colorblind in the sports climbing athlete selection. And of course, this is basic, as in all other sports. We also look into the general health screening, so family medical history, the organ system, whether or not they have any heart murmurs, lung capacity, lung disorder, teeth, dental disorders and stuff like that. So just general health screening. And then they look into the fitness level. For fitness level, there are two types or two components. One is health related. Second is skills related. For the general population, usually health related is important just to sort of gauge where we are in terms of fitness level. Are we fit enough to actually run a marathon, or are we fit enough to go into triathlon competition? And it usually consists of body composition, flexibility, muscle strength, muscle endurance, and cardiorespiratory endurance. But there's also the skills related, and usually we use the skills related fitness level for specific sports because it's specific to a certain skill. So it's all of the above, the health related fitness level, plus agility, power, coordination, reaction time. Sometimes it's either or. So sometimes it's not all of them. Like for instance, in sports climbing, agility is important, but power is not so much. Coordination and reaction time is very important. Now, now that we've covered the performance aspect of it, the most common cases that I see in my daily practice as a medical doctor, as a sports medicine specialist, is injury recovery. And this is only one case that I'm taking in. Ankle sprain is, I think, one of the most common injury, regardless what kind of exercise or sports you're doing, right? But outside of ankle sprain, sometimes I also see shoulder cases, shoulder injury cases, knee injury cases, and so on. So the science of injury recovery is actually looking into the mechanics of the ankle and also learning what we call the mode of injury, MOI. So learning the mode of injury, whether or not the ankle was inverted during the injury or exverted, whether or not it was during landing or because it was because there's an impact or contact with other players or athletes, is usually important to determine the injury journey, how long it's going to recover, what kind of treatment is actually best, and stuff like that. So first to identify the mode of injury, and then realizing a certain specific aspect related to the anatomy of the ankle itself. For instance, it's going to be different. The journey of recovery is going to be different for somebody who's already injured twice versus somebody who's just injured the ankle. And then also the recovery journey is also going to very much highly reliant on what you do right after the injury. Did you rest it? Did you ice it? Or did you just continue playing, right? So then the science would go into whether or not we need physiotherapy, whether or not we only put medication on it. And again, this is not either or. In most cases, it's both, right? Give some medication for the acute management of injury, and then to prevent it to happen again, we do physiotherapy. And then to strengthen the muscle surrounding it, we also do physiotherapy. Usually we can see that recovery can range from 2 to 12 weeks, depending on those aspects that I just talked about. Now, this is actually a plank test. I was actually going to ask you guys to do a plank test with me, but I'll save that for later. I would imagine maybe some of you would have some questions for me, and we could discuss even further in the area of sports medicine and sports science. So I'll return it back to the moderator. Candy, is that you or is...
Okay, hi. So we're in the questions part, right? Because a lot of people are very interested in your talk, and actually a lot of people have been private messaging me a lot of questions to ask you. So, oh, and they're very good questions. Okay, let me see. Wait, okay, the first one is, during medical school, have you ever had to work with cadavers?
yes, and yes. Because I know that currently there are many ways to learn anatomy. So not only with cadavers, but also slices of cadavers. But during my years, so I was in medical school from 2002 to 2008. It's a typical medical journey of 6 years. And in the first year, which is the second semester, I had to dissect a full cadaver. So it was from a full body where skin, bone, and everything is intact into actually opening up the organ system and looking into each of the organs and nerves and even the brain. There's this one time that I freaked out my mom because I took home a slice of brain in a formalin. So yes, there are some scares and some interesting experiences on that one, but yes. For those of you who might not be lucky enough to study with a full cadaver, I would generally say that as long as you have really good textbook and even slices is enough. It doesn't have to be like a full on, right? Yeah, so there are many ways of learning it. The development of technology as using virtual reality and augmented reality, so artificial intelligence, it's also a big part of medical education right now. So even though you don't see a full cadaver, there's going to be an augmented, I imagine there's going to be an augmented reality sometime down the road, a few years from now. You don't have to handle with the smell of the formalin, the smell of the alcohol, and you can just look into slices of nerves and brain functions. Yeah.
Okay, the next question. I don't know if you're allowed to answer this legally, but I'll ask you anyways. Somebody's asking, have you had any famous patients?
Yes. Okay. Yes. Well, that's a very good thing. Okay, so this specific patient has consented so that I can reveal the name, and I think Andy knows this. So I have had the experience and the luck to be handling an injured Dev Patel. So Dev Patel was the story was Dev Patel was shooting an action movie in Batam last year, and so he was injured during one of the action scenes, and he broke one of his arm finger, actually one of his bone finger, and so he had to be flown into Jakarta and then got into a surgery, and I was handling the recovery part of it, to make sure that the action scenes are shoot in a way that it's safe for his injury, but also not compromising the realness of the action scene. So yes, among others.
Okay, well, there's so many questions. Okay, as a sports scientist, do you do anything related to sports psychology and motivation for athletes?
Interesting question. I work with a sports psychologist. In fact, the first week of June, upcoming June, I think it's the 5th of June or 4th of June, I am going to speak in a national symposium for sports psychologists. So I'm going to talk about the correlation of physical injury or physical experience in relation to the mind, or in this case, the psychology of the athlete, of an athlete. Like, for instance, if an athlete is injured, how does it then affect their performance? If the injury is already clear, right? There is no physical injury whatsoever, but when they go into the field or when they go into the game, then something is off, right? So there are certain cases where physically there is no injury, but the brain or our mental image still feels that we need to be careful, or feels like we're still injured or still traumatized. Because for an athlete, an injury is trauma, right? And the trauma is not only physical but also mental, because then you get skipped on games, you get skipped on exercise and practice sessions, and of course, if that's your career, it will eventually affect your career. So yes, I do work in that aspect, but I am not the psychologist. So I usually work together with the sports psychologists. So we're in one team. So for instance, in the sports climbing team, I have 2 sports psychologists that would coordinate with me on the level of mental and cognitive state of each of the athletes.
Okay, the next question is, do you handle prosthetics too, or is that a different specialty?
So I handle prosthetics only when they're non-operative. Because I am a sports medicine doctor, but I am not a sports orthopedic doctor. There's an orthopedic doctor, which is a surgeon. So after general practitioner, after 6 years of medical school, they would take again 5 to 6 years of orthopedic surgery as a specialization. And then after that, they can do surgery. My competency is not in surgery, but usually after surgery, and if they do need certain prosthetics non-related to their surgery, or even if they're not indicated for a surgery, but they would need braces. They would need certain support, ankle support, or back brace, or even wrist support or wrist brace. That is also something that I prescribe, but I do not prescribe something that is related to surgery. That's going to be a different competency, and that's going to be on the orthopedic surgeon usually.
Next question is, some perfectly healthy athletes can die from sudden illnesses. Can you give examples of some of those illnesses?
Yes. So what we are most afraid of is the sudden cardiac arrest. So sudden cardiac arrest is, I wouldn't say common, but is not something foreign, especially in certain sports that has high intensity and high impact movement. For instance, soccer. Most of them is actually soccer. Why soccer? Because usually it's related to, in soccer, sometimes there's high bouts of energy that you need to produce. For instance, when you try to score a goal, when you try to steal a ball, right? There's high burst of energy, usually before a very calm period of time. So as you can see, sometimes this requires the athlete to, from a very perfectly calm state where the heart rate is 60 to 80 or 60 to 70, and then go chase a ball or tackle a ball, or go try to score a goalie that goes into a heart rate range of 120 above, or even sometimes 160 above. So that jump in heartbeat, that jump in heart rate and lung capacity, and also muscle and joint movements, is not free of risk. There is the risk there, and the most dangerous risk of all is the cardiac arrest or the cardiac attack, because of the jump in the heartbeat. The pressure in the blood pressure, in the blood vessels, are usually very high. So imagine like a downstream river with very low current, and then suddenly there's a flood, and then it goes whoosh, very high in flow. So imagine that happening in the blood vessel. If there is the inner wall of the blood vessel that is not sturdy or not sticky enough, so that it then attaches itself, so it deattaches itself from the blood vessels and then attached itself in the blood vessel in the heart or in the brain, then you can get stroke or heart attack. So that's the sudden cardiac attack that we're afraid of. The second one is concussion. Why concussion? Because again, brain is a vital organ in our body, and it controls our breath. It controls our organ system. So, for instance, in certain sports like American football, rugby, boxing, any kind of martial art that has a very low protective gear, it's high risk for concussion. And if there's a concussion, if it's only a mild concussion, it's fine. Usually you just rest it, you take the athlete out of the game, the risk is low. But if it's a moderate to severe concussion, which includes sometimes the loss of consciousness. So the athlete is then unconscious in the field, in the floor, in the ring. Then it's also considered a very high risk situation, because if it's not handled properly, then we can lose the athlete. So those are the two, I think, most concerning cases.
I guess with illnesses like Parkinson's and Alzheimer's are also big.
Yes, but it's usually that one is actually long term, right? Which doesn't mean that one is less than the other, but it's usually underrated.
Mm-hmm. Okay, the next question is, scientists are working on a fake heart. Sorry, I'm trying to word this in a better way. But they're asking, is it possible one day to become immortal? This
Good question.
big part.
Simple answer is I don't know. And this is one thing I think as scientists you should be able to accept that sometimes you don't know all the answers. It's okay to say you don't know because you might not know the answer today, but you might know the answer later, 5-10 years from now. So right now, I don't know whether or not we can be immortal or not. But it is true what we are seeing in the last 5 to 10 years. There are very promising research and promising technological advances in medicine that we know that now pacemakers are way better than 10 years ago. We are already at the phase where the life expectancy of the global population has already increased significantly compared to the 1980s. And then this is not stopping, by the way. This is only going to be exponentially higher. There's going to be a lot of advances in medicine and technology, so health technology as well, that might actually be able to produce a heart that is as efficient and as close to a normal human heart. Because right now there are some limitations to that. We have pacemakers, yes. We have certain technology that can prolong somebody's life after post cardiac attack. But at this moment, there is no one device or technology that can replace not only the human heart, but also the human brain. And if we consider the mechanism of it, the mechanics of it, a brain is actually much more complex than the heart. We still don't know a lot of our human brain. So somebody can be kept alive in a ventilator and a pacemaker, but is that person really alive if the brain is not functioning? So that's the question. I think that's right now it's one of the most important ethical question to ask. To what extent do we actually prolong a human life? But yes, very exciting prospects indeed.
Okay, so next, oh, there's a lot of Dev Patel fans. Is it necessary to go to medical school for sports medicine, or can a degree in health science and specialty be enough?
Important question and very interesting question. So, if you want to practice as a physician, so as a sports medicine physician, as in you can prescribe medication, as in you can see patients, then yes, you need to go into medical degree or medical school. But there are a lot of sports scientists that are non-physician, that are non-clinician as well. So you can also be a sports scientist by going into kinesiology, by going into or taking any pre-med classes like biology. So if you are not sure to specialize right now, it's okay too. Taking classes or taking majors like kinesiology, biology does not limit your opportunity. It will still broaden that, or it still be opening that door, that if you somehow decide that you want to go into the medical world from that aspect, you still can jump into the medical world. But yes, if you want to practice as a sports medicine doctor, you need to be a medical doctor first. But I am working with a lot of sports scientists that are non-doctor. So I have a kinesiologist working with me that actually handles the exercise program for my patients. And in a way, she knows a lot of more technical stuff than I do. Because as a sports medicine doctor, you sort of become, you take the umbrella approach. So you see the human body as a whole. And you you have this perspective of the system as a whole. But with sports scientists, it's very specialized even. So they know specific movements or exercise to strengthen the bicep, to strengthen the triceps, which maybe I don't even know that good. So it depends on what exactly you want to do, I guess.
Okay. The next question is caffeine really ergogenic for everyone?
Yes. The answer is yes. It is so ergogenic. So for those of you who doesn't know what ergogenic is, it means it's performance enhancing. So for instance, before you exercise, if you take a cup of coffee, you would feel much more energetic than if you don't. It is so efficient, such that the doping association, the WADA, the World Anti-Doping Association, WADA, has considered caffeine a doping mechanism. It didn't go that way eventually, but it was considering to put in caffeine as a doping mechanism. It is effective, and it is effective for everyone. But the downside of caffeine is that there is sometimes there is a tolerance level. So, for instance, if you usually take 1 cup of caffeine to get the same result, after a few years, you might actually have to increase it to 2 cups. That's the downside of caffeine. But yes, it does have a performance enhancing characteristics.
Okay. Next, it's somebody wanted me to ask you about creatine and protein powder.
Creatine, yes.
And if it's fine for, I guess, a 16-year-old guy to use.
Good question. Is creatine and amino acid, amino powder, basically all those protein shakes matter? Yes, they do. But there is a but, right? There is, like all things, there are terms and conditions. So with protein shakes, it does have the effect of increasing muscle mass. Only if and only being taken before or after an exercise that involves strength exercise or power exercise. So basically the exercise session that activates your muscle strength and power. And it activates that metabolic route or metabolic pathway that uses creatine and amino acid as the source of energy. If you take it before a cardio session, it won't really matter as much. It's just basically calorie getting in. So that's the number one condition. It only is effective if you take it for strength and power conditioning exercise. The second is it is very related to age. Why? Because when you're around 16 to 17, let's say when your epiphyseal plate or when your growth plate in your long bone has not yet closed, your testosterone level is lower. As in, we know that to build muscle mass, you need a level of testosterone level. And by the way, if you engage in high intensity strength and power exercise using external weights before you hit 17 or before your growth plate is closed, it's not good. You need to wait. You need to wait until your growth plate is closed to actually be able to go deeper and heavier on exercise that is high on strength and power. So in that aspect, I wouldn't actually recommend a protein shake unless you already hit 17 or 19 plus 8 years of age. Before that, it would just be calorie in. So it's good to know so that you're not just taking in calorie, but also getting the optimal effect of it.
Whoa, so many people just joined. Hi everyone, we're answering questions. Well, not Tanta, sorry. Dr. Sophia is answering questions. A lot of people are saying that you're very cool, and now everybody wants to, like 2 people want to major in. That's cool. Okay, the next question is, Can my lack of sleep affect my athletic performance / training, even though I'm already used to getting no sleep?
Yes, yes, it is very important, and it will affect it poorly because if now more than ever in the last 5 years, we do realize the importance of sleep, and not only the duration but the quality of sleep. So it's not only about quantity; it's quantity and quality. And why does it matter? Because if you do not get enough rest, then it's basically like you're pushing your car, but it does not have any fuel. You're running on empty, right? So you can push as much as you can, but if you don't get enough rest, then your metabolic pathway is not activated to run. Your brain thinks that it needs rest, and so it goes on survival level, it goes on survival mode. And that is the same reason why you shouldn't be running on empty on a stomach as well. Like, do not exercise if you haven't had a meal. It doesn't mean that after a meal you start exercising. No, put an hour to 2 hours distance or time before starting to exercise after a meal. So for instance, if you have breakfast at 7, then you start exercising at 9 a.m. So if you start exercising at 6 p.m., then you need to stop eating at 5 p.m., for instance, right? But you need to get some energy because, again, exercising when you're lack of sleep, even if you're used to it, that means you're just used to running on empty. That just means you're just surviving. Your body is coping and it can cope just so much, right? It will break at one point. So it's gonna at one point it's gonna say enough is enough. I need to sleep, and then you used to it. You still need to get 7 to 8 hours of sleep every day, and you need to get good nutrition in because you don't have the energy to run on an empty cell because your cells are starving. And so again, your metabolic pathway is not geared on thriving, on performing. It's just functioning.
There are 50 people in this in this call now.
Hi everyone.
Okay, the next question is a very personal question, so I'm gonna leave her anonymous. She says, I feel really bad about my body. Are there any diets that I am not allowed to do? And what is a safe way for me to do so?
Okay. I would say if you feel bad about your body, then I would actually thank you for the question, by the way. And I would like to start with I did not feel comfortable in my body until I hit 28 years old. So it's not uncommon. If anything, it's very common to feel uncomfortable, to feel bad about your body. But you do need to acknowledge that there is a healthier way to look into it. There is a healthier way of having a relationship with your body, because the most important relationship that you need to have is with you, mind, body, and soul. And that being said, I think you need to start to look into what makes you feel comfortable in your own skin, in your own body. What kind of movement, what kind of diet, and I wouldn't even say diet, what kind of food. Don't think about dieting in a way that it limits your intake, or it limits your food, but think about diet as a way to be healthy, as a way to eat, as anything else. Your relationship with food is also going to determine your relationship with yourself. So you probably the good thing or the best thing to start is start looking into what food makes you feel good, not only temporarily, but long term. So it's not about that sugar rush that you get after a bar of chocolate, but it's that good night's sleep after a good, complete, balanced meal of protein and fiber. And It's not only about what kind of exercise should I be doing, is more importantly, what kind of movement or what kind of physical activity that I enjoy doing that will make me feel like I love my body more. So yeah, I hope
Good
that answers your
answer.
question.
The next one's also very personal. Wow, everyone's being really personal. I'm sorry that you guys feel this way, but somebody's asking, I'm having a lot of hair loss and my teeth are getting weak. I have bulimia. Is that a possible side effect?
Yes, very much so. With bulimia, what you are basically doing to your body is starving your body, because before your body even has the chance to digest the nutrition, digest the vitamins and minerals, to actually absorb all the good nutrients from the food, it was already taken away from them, right? So in a way, all the hair loss, the tooth problems definitely are affected by your intake right now. And again, I think the first this is already a good sign that you're acknowledging it and recognizing that it happens, because some people don't know that it's actually a problem, right? So it's good that you are now already recognizing it as a problem. I have bulimia. Okay, now what to do? Aspect, there is going to be an extensive support needed, because it's not only about forcing yourself to eat, because then it's going to be a cycle of forcing yourself to eat and then throwing it out again, and probably not eating at all sometimes, right? So it's not, you are going to need support from your support system, and whoever is close to you, whoever you trust right now, whoever you look up to, and also getting the help, professional help that you need. Um, Getting to see a doctor or a physician that can help you through that journey of getting to a healthy lifestyle, and nutritionist and psychologist. So it's not only about eating, but it's also how to define a healthy relationship to eating and food. So again, talk to your parents or talk to any adult that you trust and feel safe, and try to get help by seeing a psychologist, a nutritionist, and or a doctor.
Thank you. Okay, there are more questions. Hi, for those of you who just came, a lot of you just came, we're doing a question and answer session with Dr. Sophia. Feel free to PM me any of your questions. Okay, the next question is, does falling asleep while on my phone negatively affect sleep quality by a significant amount?
Good question. Now I'm going to answer that scientifically. We don't know the exact amount, just significance. I cannot say the percentage, the accurate percentage of it. Like if I say physical activity and exercise can reduce dementia by 30%, I am sure of it because there is a lot of body of evidence to it, right? But do I know the exact number? No, I don't. Is there an exact number? Most likely there is. It's not on top of my head right now. But does it affect your quality of sleep by sleeping on your phone or on your laptop? Yes, it does. And the reason being is because there's a lot of studies and research that has been done on the brain waves, how the brain wave is affected by the light that is emitted through your gadget, whether it be a phone, whether it be a pad or a tablet or a laptop or even TV. So whatever your gadget is, if you're sleeping while it's on, there is most likely going to affect the brain wave and the brain wavelength, so that you are not as easy as other people going into deep sleep. And deep sleep is very important. Deep sleep is what we know as rapid eye movement, REM sleep. So there is a certain period amount of REM sleep that you need to have every night to be able to then wake up fresh and work productively and efficiently. So That's why it's most important to sleep without any gadget on, and if possible, with all the lights off. If you do need some light, it's going to be a low level light, right? Usually a sleeping light. But definitely design your sleeping space to sleep, not to work, not to watch videos, not to text, not to binge on films or videos, but to sleep.
I slept on my piano last night. The next question's from Miss Ravender. She asks, people say to have a run in the morning, but you have breakfast later. So is it wrong?
It's not wrong as long as you have something in. Like breakfast, sometimes the analogy of a breakfast is a full meal, but you don't need to run on a full meal. Sometimes, like I said, running on a full stomach actually slows you down and causes cramps. So what you need to make sure is that your cells, your body cells, your muscles are actually getting energy before you run. How do you do that? An hour before you run, take a banana, or a smoothie, or an oat, a bowl of oat. It doesn't have to be a full meal breakfast. And sometimes if it's only a banana, 30 minutes before the run is enough. It doesn't have to be an hour, as long as you get something in your system, in your cells, so that it doesn't starve, so that it doesn't run on empty. And then after running, again, give it an hour. Do not eat right away, because if you eat right away, the blood flow. So if you run, 70 to 80% of your blood circulation level is in your extremities, in your legs mostly. So can you imagine if 70 to 80% of your blood is going to your legs while running? Only your body is only functioning on 20 to 30%. The digestive system, the brain is most likely not geared to working, right? So in that aspect, you need to get the nutrition in before running, because when you run, you want the 70 to 80% blood brings nutrients and oxygen in efficiently. And then after that, give it 30 minutes to an hour before the percentage of the blood circulation recovers. So when you eat, the food is digested properly as well, and optimally as well.
Okay. The next question is, hi, I am a 17-year-old boy, and due to the pandemic, I've gone into a workout schedule, and recently I've been doing some weightlifting. Is there a certain weight limit for my age? Also, should I be taking things such as whey protein or creatine at 17?
Yeah. So good on you to start exercising. There is no age too late to start exercise. So it's a good habit. And do you need to start exercising on strength? Yes, but do not put on external weights. So use your body weight. There's a term that we call calisthenics, as in strength training using your body weight, as in sit-ups, push-up, pull-ups. So do not put dumbbells, especially heavy barbells, into it. At this point, you might actually grow taller until you're 19. So it doesn't mean that you are not supposed to train your muscles. You do need it. You need to start training on your strength and power, but use your body weights first. And if you want to add a little bit more extra, you can use rubber bands, and the 1 to 2 kilo weights is okay, but do not go beyond. Again, because we don't want to initiate the closing of your growth plate sooner than before. And do you need to take any supplements? I do not think you do. There are numerous studies right now that are assessing whether or not it is needed. But most of those research that says it is needed is usually, one, if you're a professional athlete. So in certain cases where you are a professional athlete or a collegiate athlete and you are not yet above 17 years old, there are sometimes a need for that. But unless that's the case, you don't need that. And the most important thing is during your teenage years, especially before you hit 19 plus, you are still very much effective in and nutrient absorbent. So just as much as you can, diversify your food intake. You want to get a lot of fiber. You want to get a lot of protein as well, not only from meat, but also plant-based protein. Just get a lot of diversity on your menu day to day, and make sure that you eat properly and correctly, as in breakfast, lunch, and dinner. Get that into your system. You don't need any supplements yet.
All right, there are so many questions. I'm sorry I won't be able to get through all of them because we only have 5 minutes left. So let's go through them really quickly. We'll try to get as many as we can. Okay, the first one is, this is a good question. At what age do we stop growing, and how can we grow taller at this age? We're all 17,
Yes.
16, 17.
16, 17. Okay. So when do you grow? When do you stop growing? It's a range, right? There is no specific age for each and every one of you. Usually the range is between 19 to 21. Sometimes you finish early, 19. Sometimes you grow a little bit until you're 21s. So it's a range of 19 to 21. And what can you do is one, do not discount your sleep. So do not. So you need 7 to 8 hours of sleep to still grow. So sleep properly, sleep efficiently and sufficiently, and eat properly as well. You need the right nutrients. You need a balanced diet. So try to get in carbohydrate, protein, fiber, vitamins, minerals in. And in terms of exercise, you need a balance of lengthening your spine and also the stretchings. So how do you lengthen your spine? Exercises like swimming, like jumping jacks, basketball. Those who require jumping and hopping, that's lengthening the spine. But do not stop only by lengthening the spine. You also need to stretch it out. So a good session of stretching, such as yoga or Pilates, is also beneficial to keep growing. And this is specifically for growing taller. Okay, so the exercise that I just said is specifically for growing taller.
Okay, next question is, I've been struggling mentally, which led me to stop exercising overall. How does the stop of exercising into our lifestyle affect our body? Is it both physically and mentally? And do you have any tips to get back into the motivation of exercise?
Yes, for this, I am going to show the slide one more time because I think it's very important for you to know that in the beginning of the slide. Ooh, hold on, there. In the beginning of the slide. Ooh, in the beginning of my presentation, I shared with you the importance of physical activity on the brain in major depressive disorder. And this is something that I had personal experience with as well. So I do know the difficulty in moving yourself, in getting up and getting into an exercise routine when you're depressed. It is difficult. So start slow. So I'm going to answer on the motivation level first, right? Because it speaks personally to me. So start slow. You don't need a complete program. You don't need to, okay, I need to wake up every day 5 a.m. To do 1 hour of exercise. Forget that, okay? When you're just starting, just get used to moving. So as simple as if you wake up at 6 a.m. or if you wake up at let's say 7 a.m. It's okay. Just use the first 5 minutes when you wake up to stretch, to get your body to be used to stretching, to get your body to be used to be moved, and then you try to do it every day. And after you're used to just 5 minutes of movement, and then try to increase it into 10 minutes, or you can divide it into a range of sessions in the middle of the day, like 5 minutes in the morning, and then 10 minutes in the day, and then 5 minutes before you go to sleep. As much less energy that you can do, less commitment that you can do, but you can do it well. Like there's low level of failure, and there is a high level of success. And you need to identify that. You need to think with my pattern of physical activity, with my pattern of depression right now, when is the right time for me to ask kindly to my body to move? And if it's only 5 to 10 minutes, it's fine. Just start, and then start stretching, and then start jogging, or if not jogging, walking, from stretching to walking to jogging, and then maybe explore things that you like. For me, it was yoga. For me, I couldn't bring myself. I used to run, but when I was depressed, I couldn't bring myself to run. So for me, it was yoga. For me, it was 10 minutes of yoga in the morning, 30 minutes yoga in the evening. And I do it every day until I was well enough to actually start running again. But this is important. And yes, it does affect the breath. I'm sorry I'm answering this long, Candy, but yes, it will affect your depression, and it will affect it in a good way. Once you start exercising, you will feel that it has the same effect of therapy as a cognitive behavior therapy, and even as efficient as a medication.
Okay, there are so many questions. I'm sorry I cannot answer anymore. So I'll take a picture and send all of your messages to I'm sorry. I'll ask her all of your questions and send you in the answers later. But thank you. That's all the time that we have. Thank you so much for coming. And
my pleasure.
I'm glad that I can host you. So yeah, that concludes this session, everybody. Can I hand it over to Nadia to do the next segment?
Thank you, Candy. Thank you, everyone. I hope it's a very informative session, and I hope you can take the benefits out of it.
Yes. Thank you very much, everyone, also for joining, because there's a lot of people who are joining here. I hope you find it really interesting. Okay, Nadia?
Candy, can we have photo session with Dr. Sophia?
Oh, okay. We were yes, okay, sure. Yeah, that's okay.
Also the certificate. Who will take the screenshots?
Is this like for the whole? Okay, I'll take the screenshot. That's okay. I'll do that. Smile, everybody. Okay, more people are turning the cameras on. That's fun. Okay, everyone, turn your cameras on if you want to. Yes. Oh my God, this is so funny. Okay.
You have the most participants, 68.
Yeah, there was 70, but I think they left.
Okay.
Oh, thanks for turning your cameras on. That makes me so happy. Whoa, there's so many people. Okay. Is that all? Okay, there's more people. Wait. Okay, smile. Okay, I did it. Yeah, okay. Does anybody have the certificate, Nadia?
Yes, I do. I'll screen share.
Thank you.
So once again, I'm Dr. Sophia Hage as representing the whole. We as the Buzz Lab Club would like to present to you the certificate of appreciation for sharing your valuable knowledge and insight as a guest speaker recently concluded Science Fun Day 2021.
Thank you, everyone.
Thank you very much. It was very inspiring and informative. Very interesting. Thank you.
My pleasure.
We have the most participants.
Well, that's fun.
Thank you so much. Is everyone allowed to leave the breakout room now to the general? Okay, everyone, you can go back to general and leave the room. I'll be taking pictures of the chat just so that.
Thank you.
Thank you.
Thank you. You did a